Can FNA diagnose lymphoma effectively? Imagine a quick, minimally invasive test that can give you clues about a swollen lymph node. That's what fine needle aspiration, or FNA, aims to do. It involves inserting a thin needle into a lymph node to collect cells for examination. While FNA can sometimes detect lymphoma, it's important to understand its limitations. It is not usually enough on its own to make a definitive diagnosis, especially for non-Hodgkin lymphoma. The accuracy of FNA in diagnosing lymphoma varies quite a bit. Some studies show it can correctly identify lymphoma in about 2/3 to over 90% of cases, depending on the specific subtype and whether additional tests are used. Hodgkin lymphoma tends to be diagnosed more reliably with FNA than non-Hodgkin lymphoma. However, FNA often cannot provide enough detail to classify the exact type of lymphoma. For example, only about 29% of initial FNA diagnoses of lymphoma could be fully classified according to standard systems. In fact, only around 12% of FNA results matched the findings from more thorough excisional biopsies, which remove the entire lymph node for examination. Adding advanced tests like flow cytometry, which analyzes cell markers, can improve FNA's ability to detect lymphoma. When combined, FNA and flow cytometry can increase the chances of correctly identifying lymphoma cells and reduce false negatives. Still, even with these techniques, FNA struggles to determine the precise subtype of lymphoma, which is crucial for choosing the best treatment. The gold standard for diagnosing lymphoma remains the excisional lymph node biopsy. This procedure involves removing the entire lymph node, allowing pathologists to see the tissue's architecture. This structural information is essential for accurate classification and treatment planning. FNA only samples individual cells, missing the tissue context needed for a complete diagnosis. In clinical practice, FNA can be a helpful first step. It's less invasive and quicker, providing initial clues that can guide further testing. If FNA results are inconclusive or suspicious, a full excisional biopsy is usually necessary to confirm the diagnosis and determine the exact lymphoma subtype. A negative FNA does not rule out lymphoma, so doctors often relying on additional tests for a definitive answer. In summary, while FNA can be useful for raising suspicion of lymphoma, it is not sufficient by itself to diagnose or classify non-Hodgkin lymphoma reliably. It's best used as part of a broader diagnostic process that includes immunophenotyping and, most importantly, an excisional biopsy. Always consult healthcare professionals for personalized advice and follow their recommendations for accurate diagnosis and appropriate treatment.